As first responders, when we come upon emergency scenes, people are in crises. People are always upset. And it doesn't matter if you're a cop, if you're a firefighter, if you're in emergency management, if you're a paramedic, if you're a search and rescue professional. Most of the people we deal with at emergency scenes are in crisis. Some of the people we deal with are mentally ill. And wouldn't it be nice to know if you could understand if someone was mentally ill when you try to interact with them? Because at these emergency scenes, you need to talk to witnesses, bystanders, victims, etc., in order to find out what's going on and what course of action you need to take. You also want to make sure that these people aren't interfering with your operation and they aren't endangering themselves. So to help us understand a little bit about this, give us some tips for how to handle these situations, we have Dr. Greg Sancier here today. Greg was a cop for 30 years, a hostage negotiator, and he has his PhD in psychology, so he's well qualified to guide us through this. Greg, you know, as first responders, we respond to emergency scenes, of course, all the time. Sort of by definition, at emergency scenes, people are upset because they're in crisis. Something bad is going on in their lives. Mm-hmm. What is it, when I get to an emergency scene, that will tell me that somebody might be mentally ill as opposed to just being normally upset?
Well, what happens if you have mental illness, then the term is it exacerbates everything. So at the scene of something, whatever the crime, maybe they're a suspect, maybe they're a victim, maybe it's a hazmat scene or an explosion, we don't know what it is. The issue being that you want to look for a certain set of behaviors, and let's say you don't really have much training in this area of mental illness. What you want to look for is a certain set of behaviors that's going to be a cue to you that there's something not quite right. So what you have to be able to discern is, clearly, is this person upset because they got assaulted, they were a victim of a crime, etc.? Are they mad? And the problem is that nobody out there really knows. I mean, do they have a traumatic brain injury? Do they have schizophrenia? Are they bipolar, have schizophrenia, and have a traumatic brain injury? No one has the time or the ability to be able to tell that at the scene. So what you have to do quickly is, number one, ensure that the scene is safe. When you know that the scene is safe, then you can do the contact of that individual. And so what you have to do then is notice a certain set of behaviors. There's a term called being psychotic, which is typically used for people that have maybe schizophrenia or bipolar disorder. If they're psychotic, it means they could be acting out. What does that mean? Acting out is simply maybe they're yelling or screaming at someone that's not there, and you arrive and you see, well, who are they yelling and screaming at? There's nobody there. The first thing that you want to try to do is something called, what I call, is a reality check. You come up to the individual, and regardless of the type of first responder you are, I'm Greg, what's your name? If they can't respond to you, then you know that perhaps they are psychotic, or clearly they're so upset that they can't respond. But typically, even though people are upset, they can respond back to you with their first name. If you know they can't, then they may be psychotic, which means your ability to communicate with them intelligently and in a caring way is going to be incredibly difficult. So once you've guaranteed the scene is safe, you know you can talk to them, try to get their first name. Once you get that first name, you're going to know, okay, I can talk to them, they can answer my questions. If you ask them their name and they say, my name is Zortok from the planet Zigrub, we've got a problem. Would that make sense? Because they're probably so psychotic that they can't talk to you intelligently. But if they say back to you, my name's Steve, and you said your name's Greg, that's correct. Steve, here's what I'm here for. Are you aware of crime occurred today? Yes. Then you have to ask them very short, succinct questions, because you don't know if they can follow your questions. They may not know, even though you have a badge in your chest or a firefighter's gear on or a paramedic, they may not really know who you are. But by asking those short, simple, concise questions, getting their name, getting simple responses back will enable you to know if, yes, they indeed are maybe psychotic or maybe they are not psychotic.
So not seeming to live in reality is one sign that someone might be mentally ill and need some special skills. Are there any other signs that we could pick up on, and fairly quickly, obviously, that would tell us that, hey, this person is mentally ill, I got to treat them a little bit differently?
Well, if you're not getting any response, you're trying to communicate with them. And one thing that's very common from medications from some time ago is something called tardive dyskinesia, where they might be rocking back and forth, and you're trying to talk to them, and they're virtually incommunicative. And that's called tardive dyskinesia, which if you see that behavior Very classic, related to the medications that were used some time ago. Another thing is if they're highly depressed, they might be so depressed that they can't speak to you either. And something to be mindful of is you can have any number of behaviors. They might be incredibly angry and out of control, and then they might become despondent, or they might be very aggressive, or they might talk down to you. So a lot of behaviors are related to the specific kind of mental illness that we're referring to.
It sounds, Greg, like what you're saying is that we see people in crisis all the time. And I mean, that's abnormal behavior, but it's normal for us because we see it all the time. And if somebody really is mentally ill and is going to require some special skills, that we'll kind of pick up on it because it's not, it just doesn't look like a normal person in crisis. Is that right?
It is right, but the issue being, what is the specific mental illness? And that's where we're going to split hairs a little bit. If you're not adept at identifying a certain mental illness, that's where there's going to be problems. Why? Let's say they have schizophrenia, hallucinations and delusions. You ask them, what's your name? I'm Zagreb from the planet Z-Talk. Going to be a problem, right? Especially if it's a dynamic scene where there's safety issues. So you have to get through that. If there's hallucinations and delusions, how do I address that? How do I talk to that person? Well, if you can't communicate to them simple things like, explain to me what happened today, or tell me your name, then you're going to have to make other arrangements, which means maybe they have a case manager that you can get a hold of. Maybe there's someone there who does have mental health skills that can help you with their responses. Let's say they have bipolar disorder. Maybe they're very manic. What does that mean? Manic is very, very active, agitated, won't talk to you, won't give you their name. They're making you angry, and you can start to feel yourself getting angry as you're trying to talk to them. So that's another distinct behavior. Or they're severely depressed. Maybe they're so depressed that they don't even feel like they want to answer the simplest of questions. They can answer the questions because of whatever the medication they're taking or the depression level. They either A, don't want to talk to you, or can't talk to you because of their state of depression. So I'm not trying to be complicated about my response, but those are things that need to be addressed when you get to the scene.
Well, it's interesting you mentioned those different kinds of illnesses, Greg, because is it important for a first responder who's just trying to get something done at the scene, trying to get somebody out of the way or get some information because it's really time critical, is it important for them to be able, or highly useful for them to be able to understand what kind of mental illness someone has, or does it just matter to them that they're mentally ill?
Well, if they have the time to get to that place, that's fine. But once again, if it's a dynamic scene where safety is an issue, just doing the very basics, my name, your name, I need you to get out here with me so we'll all be safe. But if you have the time to be able to figure out what they may have, it will enable you to get the kind of answers you want. Once again, schizophrenia, if they're hallucinating and having delusions and they can't even tell you who they are or their name or where they live, its own set of problems. If they have bipolar disorder and they're talking down to you, they're moving so quickly that it's causing you to be fearful of your safety. They look like they have potential aggressive behaviors, the way they move and things like that. And clearly someone who's severely depressed may just be, in a fetal position on a bed when you're trying to talk to them. So you have to address all those behaviors, and if you can figure out if they have a case manager, maybe the case manager who's on the scene can say, oh, John has this, and that would help you figure out with a mental illness how you can communicate with them.
Greg, you mentioned a number of different kinds of mental illnesses that we might encounter on the street, some common ones. Before I ask any other questions, real quick, if I don't have any psychological training, are there any resources available for someone at a first responder level to quickly grasp some knowledge about different kinds of mental illnesses and what the symptoms might be?
Well, absolutely. Most of the states now have what's known as Crisis Intervention Team Training, or CIT is the acronym. I know that's available in a lot of the major cities. Smaller jurisdictions may not have that exact training, but they can access it. And I know that a lot of agencies are teaching first responders the same training, firefighters and paramedics, to get the Crisis Intervention Team training. Also, there's an organization called the National Alliance for the Mentally Ill that's available in all communities, and you can contact your local representative from NAMI, N-A-M-I, to also see what training would be available, because they have a lot of resources also. Another resource that's available is to go to hostage negotiators in your local jurisdictions, because a lot of the training they have is very advanced, and it has to do with the mentally ill conditions, many of which we've talked about also. So if you go to them and say, listen, can you put on some training for us in terms of how do we deal with the mentally ill, what kind of techniques to use to diffuse them when you go on your call-outs, because that type of training is invaluable if your CIT training or your NAMI training isn't something that's available to you. Your hostage team certainly would have a lot of that knowledge.
How important is it for me as a first responder showing up at a scene, encountering somebody that I think might be mentally ill, to know exactly what kind of mental illness they have? I mean, we have to remember, we're talking about time-critical situations. I need to get time-critical information out of somebody right now. Where'd the bad guy go? Who's in the burning building? Or I need them to not interfere with my scene. I really just need them out of the way and they're trying to interfere with me. So I got to get something done right now. How important is it for me to be able to do a quick field diagnosis of what kind of mental illness they might have? Or is there some kind of generic strategy that I could employ, not being a professional, not knowing much about this, for most kinds of mental illnesses?
Well, the first thing you want to do clearly is it a safe scene. You've determined that. You try to do a reality check. Do you know what today is? Do you know who I am? I'm Greg. I'm with this police department. I'm with this fire department. Then you figure out, yes, they do know who I am. If I ask you a few questions, could you help me with that? Now, they may be able to say yes. They may say no. But you're going to find out when we've done the reality check that we've discussed. You start asking them simple questions. You take your time. Now, the problem being, most people that are suffering from severe mental illness are confused, they're fearful. Let's say you're a first responder who's 6'4", 290, and they're 5'1", 106, and there's a huge power difference there, clearly. One thing that you want to do, because you haven't had this training, so one thing that you want to ensure that you do is give them caring behaviors, respect, empathy, and dignity. Because why? Because many of the people that we come across in those circumstances haven't gotten that. So what you have to try to do very quickly is to establish your credibility and just be a human being with them without any real amazing techniques. Just go back to being a human being, and many times that will be what you need to resolve the situation.
Just to be clear, Greg, here, we're talking about employing a strategy to deal with mentally ill at emergency scenes, but clearly this doesn't apply if the mentally ill person is a danger to themselves or others. I mean, under those circumstances, they just need to be whisked out of there as fast as possible. And if you aren't the police, you're some other kind of first responder agency, you need to get the police to do that for you. Is that right?
Yeah, absolutely. Yes, that's correct.
It's nice to know that there's one overarching strategy that might be employed, this CRED strategy. Can you give me an example of how, for instance, that might work with say a firefighter showing up at a fire, first on scene? He encounters someone that you might know is schizophrenic. He just knows they're mentally ill. And this firefighter needs to immediately find out who's in the building. Are there any occupants that are still alive in that building?
Well, the first thing that I would recommend is, clearly, as we've discussed, reality check, find out if they know their name. They know their name. I say, hi, my name's Greg. What's your name? Ralph. Ralph, well, listen, you can see that the building's burning right there, and it would really help me and the fire department if we could figure out if someone else is in the burning building. Does that make sense? They're going to say yes or no. Well, we could use your help with that. Is this the building you live in? Yes. Okay. Well, you can see that the building's on fire. We don't have a lot of time. If I ask you some questions, do you think you'd help me figure out if we need to get in that building like right away? Hopefully they'll say yes. And once again, using those caring, respect, dignity, and empathy questions, slowing yourself down. Clearly, you've got to get in that building, but you have to take the time to slow yourself down first to get the responses you want from the person. So that being said, I'm going to slowly ask you a set of questions. And Ralph, do you understand what I just asked you? They don't. Okay. Well, remember I just said a minute ago the building's on fire. Okay. Well, the building's on fire, and we need to get in there right now. Do you know of anyone in the building right now? Yes, no, whatever the response is. And the way that you do that is, number one, you have to slow yourself down because clearly you're going to be excited, and we know that you're trying to get in that building. Secondly, you have to be able to give them the questions slowly because depending on what their mental illness is, they may only hear, if they have schizophrenia, maybe every one to third word that you're using. So you have to make sure when you speak to them, Ralph, could you just repeat back to me what I just asked you? Well, I think you just asked me if there's anyone in the burning building. Absolutely correct. Thank you. And deal that way. So A, you have to slow yourself down. B, you have to ask the question slowly and thoroughly so they can process it, because they may not be processing information with all the action going on. Remember I said earlier they might be confused, fearful, or in crisis themselves, or they may even be on street drugs too. We don't know any of those things. But if you can slow yourself down, ask them questions slowly and distinctly, you'll probably get the kind of responses that you want.
You just said, Greg, is really hard. I mean, we get to scenes, we're pumped, okay?
Yes.
And we just we want to jump into action. How do we make ourselves slow down?
Well, I think we've all had stress management classes, and not to go into too much detail, but just remember to slow your breathing down, catch yourself, take a few deep breaths, slow yourself down, think of the questions that you want to ask, and it's not unlike having trying to relate to small children or teenage kids that are highly excitable, is that you want to take your time to formulate your question, fully expecting your answer to be very rapid and very detailed. But what you have to do to make sure that they're slowing down is you ask the question, maybe they're confused about the question, then ask them, well, Ralph, do you know what I just asked you? Could you repeat it back to me? Well, I think you asked me, do I live in this burning building behind us, and is anyone else in the building right now? That's exactly what I asked. And commend them. Outstanding. Thanks so much for your help. Because people, once they understand what's going on many times, they want to help the police. They want to help the fire department. And if you make them empowered, and that is, listen, you're really important right now to us trying to help people. Can you help me right now? And everyone clearly wants to be made to feel bigger, right? And remember, as I mentioned earlier, many of these folks clearly disrespected, fearful, and confused. But if you say to them, listen, this is very important, I need your help right now, then typically they'll respond in kind.
Let's look at another a quick example here, Greg. Let's say you've got someone on a search and rescue team, and they've come across someone in their area of responsibility that they're searching, and they're trying to get information from this person, whether they've seen the lost person or the victim. When they first interact with this person, they can tell this person's probably mentally ill. Okay. They don't know what the mental illness is. So they're going to go and try to employ the CRED strategy. Let's, for the sake of argument, say this person is depressed. The search and rescue person doesn't know that, but how might that back and forth go with the search and rescue person trying to employ the CRED strategy?
Well, if they come across that person and they do the CRED, they do the reality check, listen, we're looking for this little kid who's lost. Yeah. Can you help us today? And they're reluctant to respond. They take a lot of time responding to simple questions. So the search and rescue person knows that there's something definitely wrong. But by giving those caring behaviors, you find out their first name, if they can give it to you. And then just once again, you're going to be a human being with them. You're going to slow down the questions, because if you think that they're depressed, it may take them a long time to formulate an answer. So just like many of the other mental illnesses, the same applies here. So you're going to show them respect. You're going to respond to the fact that they're taking a while to formulate their answer, but you're not going to rush them. Many times people that are severely mentally ill, as I mentioned earlier, are confused and fearful. Well, here's someone who's depressed, who is having trouble just formulating their thoughts. So by slowing yourself down once again and giving them those behaviors, taking time to say, I'm Greg, what was your name again? Do you understand what I asked you? They repeat back to you, or maybe they can't repeat it back to you. But the thing is that you have to take your time, take those deep breaths if you're stressed out, and ensure that they understand what you're asking, and that can take time. Maybe you're in a hurry to find that lost child. We understand that. But once again, that person, if they're stressed out because of the depression, they're going to know that you're stressed out too. So you once again need to slow yourself down and then employ the CRED strategies, and that should get you the answers that you need.
Greg, are there some situations or maybe even some mental illnesses for which this CRED strategy is unlikely to be effective?
Well, yes, there is, and there are, and that's talking about bipolar disorder, when someone's in what's called manic phase that we may have talked about. You're going to know immediately in your gut that something's not right. So what that is, you try to employ the CRED strategy, and as you're talking to them, they're non-responsive, resistant, not getting any responses, and you get the feeling that they're talking down to you. You're immediately going to notice that your gut is starting to knot up, and you're going, what is wrong with this, whatever expletive you want to use? Something's not right. They're not giving me any responses that I need to solve this case or what have you. So you need to be mindful of the fact that you're not getting responses, the CRED strategy isn't working, I'm getting stressed out, I'm getting angry, I need to take a step back because we all know, regardless of what first responder duties you have, you're trying to get information. This person will be incredibly reluctant in many cases to give you that information. You need to step back, recollect yourself, and perhaps get help there that can assist you with this person. One thing you need to remember that also that bipolar people in that manic state can be extremely dangerous. You need to be able to recognize that as quickly as possible. If you can see them getting more agitated, then you need to know that it's a good idea to try to back up, get out of there, and get more help.
Greg, is there anything that we shouldn't do if we suspect somebody is mentally ill, or maybe things that we should remember to do and not do?
Absolutely. One of the things you want to do is not go too fast. If you're trying to get something related to a crime or something like that, you want to slow yourself down. You don't want to ask them too many questions too rapidly because once again, if let's say they have schizophrenia, they may have trouble formulating a response. So slow yourself down, questions not too fast. You want to know if they feel safe because that'll enable them to trust you more. Most people aren't asked that question. If you say, do you feel safe where we are right now? They'll give you a yes or no answer, but they'll know that you care about their welfare. And you want to be able to have good faith with them, and that is done by asking them such things as, are you okay where you are right now? Can I get you some water? When was the last time you had something to eat? I can see that you don't have any shoes. Can we try to get you a pair of shoes? Or do you need a jacket? Creature comforts that enable them to feel like, gosh, this person really does care about me, and then they'll be far more forthcoming with information.
By definition, emergency scenes are typically fast-moving events. Obviously, if I've only got 10 seconds to try to talk to somebody, trying to employ any strategy other than what's happened, asking them what happened is not going to work. But if I have as little time as a minute and I'm trying to deal with somebody mentally ill, is it worth trying the CRED strategy?
It is, as long as you explain, who you are, what you're there for, the need, and you can give them the caring behaviors and everything, first names first, all that type of thing. Explain why you're there, explain how critical their information is, and once you make them feel like they're safe and their information is important, absolutely. If you have a minute and you can do so safely, I would recommend highly that you try that strategy.
So if I had 10 minutes, it would be great, but if I only had a minute, it's worth a shot.
Absolutely correct, yes.
Greg, I really like this idea of CRED. I mean, it's a nice, easy-to-remember acronym. I can remember what it stands for. I can remember how to employ it. I won't forget it a year from now, so that's great. I'm out on the street one day. Here's my opportunity to use it, and it's not working for me. Right. What else should I try?
Well, I think they have a saying in the military, improvise, adapt, and overcome. Certainly on the street, it's no different here. Let's say you have a police officer who's 6'8", 250, and you have a diminutive male or female who's clearly maybe intimidated by the size of this officer, paramedic, firefighter. Okay, maybe get him out of there and find a female who's maybe closer to the size of whoever you're talking to. That can have an effect. And to be honest with you, sometimes culturally there's an issue. If you have someone of a different culture, maybe they're happier having someone of the same culture talking to them. And it might be even in that same language. It could be Vietnamese, it could be any culture. And I know that certainly in parts of the community out here in California, that's worked for us many times. Sometimes that's a luxury. Maybe you don't have that person at your disposal. But it's certainly something you should think of trying. But I know a lot of the time, even though there may be a cultural bias, you can just come up to someone with a bottle of water and go like that, and they'll go, thank you. And that crosses all kinds of barriers. If someone knows you care enough for them to get them a bottle of water or something similar, maybe they're freezing. You get them a coat, something caring. And I know a lot of the times I've done something as simple as just touch their shoulder, not harshly, but just in a caring gesture. Sometimes that can work. And once again, as you mentioned, the CRED factors, but to be honest with you, occasionally it doesn't work. But I know if you bring in those human qualities that we all have, that can always work for you.
Greg, could you sum up for us, please, the CRED strategy, what it is, how you use it, and what we should keep in mind as we're out on the street responding to emergency calls?
What's critical to keep in mind about the CRED strategy is how it can work for you at all kinds of scenes, and especially with the mentally ill. You want to remember that the first letter C is for caring. Just show caring behaviors, just like you would with any person. And something good to keep in mind is maybe you're dealing with even a child, so you know the caring behaviors with a child work beautifully. Another one that we hear a lot of is give that person back respect. Typically people on the street that are homeless, severely mentally ill, sadly and unfortunately live in situations that are horrific. Sometimes they live under bridges, overpasses. Sometimes they live in board and care homes. But the point is to give them back their dignity and respect. Many times you're talking about now veterans, people of that nature. So it's critical to keep that part in mind as well. Another one is empathy. Put yourself in their position. Empathize with what's going on with them. It's not always easy to do. After you've gone to your umpteenth call with that homeless person or someone who's down and out, it's hard to maintain that empathy. But if you do, you're far more likely to have a successful outcome. And the last one, of course, is give them back their dignity. People that are in this condition, in this part of their life, oftentimes are not given any dignity. They're treated horribly. They're treated horribly where they live. And if you can give some of that back to them, you'll be far better off. Another thing to be critical and mindful of is the fact that the scene might be in crisis or dynamic, which means if there's bullets being shot, if it's a fire, if it's a hazmat, you're going to have limited time to get information. But what you need to do is, if you're under a lot of stress, is slow yourself down. Calm yourself down first. And if that person does have mental illness, many times they'll see that you're calm and will respond in kind. Do a reality check. What is that? If you have someone who's got schizophrenia or bipolar disorder and they're having hallucinations and delusions, try to find out if they actually know who you are, but also, can they give you their name or not? And do they remember your name? Another thing to be mindful of is make sure when you ask them a question, they give a response, but if you have to give them a set of instructions, make sure that they can give them back to you. If you give them too lengthy instructions or you ask them too many questions too quickly, they won't be able to respond back to you. If someone has schizophrenia, they may only hear every first to third word that you give them. So always making sure they can repeat back to you is critical. And then finally, your safety is critical as well. You want to ensure that they know that they're safe and that they're safe with you. Always ask them, is there anything I can get you? Would you like some water? Do you need to go to the bathroom? When was the last time you had something to eat? All those things that keep us in touch with being human beings certainly is something that they may not have been done for them in a long time. So if you can maintain those behaviors, the outcomes are far less stressful for you and for them and will be far more successful.